Hey everybody, it's Dr. Sarah at 901 PT. I just wanted to send a message just to let you guys know what we're doing to stay focused on being there for our patients in these uncertain times. Ultimately, we're still open and treating patients. We have a very low volume clinic and are able to treat basically one patient at a time, which allows us a little bit more control of the environment. And we've also doubled our efforts to help keep everything clean, keep surfaces wiped down, and are remaining very diligent in that. Ultimately, for those individuals that are still maybe at high risk and or still not comfortable coming into the clinic, and or maybe struggling with childcare because kids are at home and out of school, another option that we are offering is telehealth. And so I wanted to do a quick video on what telehealth is and why might that still be beneficial for you in this time. Ultimately, telehealth is a virtual consultation with the physical therapist. We have 30-minute and 1-hour options, which would allow you to still check in with the therapist. And in doing that, we can determine how are things responding, are things continuing to get better? If you're a current patient, how is it responding to the things that we're already doing, and how is it changing over time? As opposed to not having that check-in where we're not able to tweak things, we're not able to progress, we're not able to move that dial forward. So it's a really good option for those that maybe have already been under that wing and already been treated, but are looking to continue to make this time productive during that time off. It's still a good option for new patients as well, because it allows us to be able to at least initiate and start making some change, as opposed to waiting for that injury necessarily to get worse. It allows you that one-on-one consultation with the physical therapist. So our goal still remains the same, to stay dedicated and to that patient one-on-one in that time. The other thing that it offers is the ability for us to do a movement analysis. So as physical therapists, we are movement experts. This is what we know, and this is what we do to help come back from injury. We understand movement, and we know how to adjust movement. And due to technology, we still have the ability to tweak that over Skype and over FaceTime. So it still allows us to break down movement patterns and teach you exercises and teach you how to move better, which is ultimately the goal. It also allows for us to be able to give you a prescriptive program to target the issues that you're having. So again, instead of necessarily finding random exercises that may or may not benefit you, you still have the benefit of that one-on-one consultation. Somebody has looked at you, somebody is seeing how you're moving and watching basically how your pain changes through movement. So telehealth is a really good option, both for people that have already been seen by their physical therapist, that it still allows us to check in and continue to move the dial forward. Ultimately, the best thing that we're trying to do is stay calm and stay focused on trying to help patients live the best life that they can. And in doing that, and albeit while they're uncertain times, still staying moving is such an important part of that process. And we want to do our part to help make that easier for you. So if you're curious, please send us a message, reach out. We would be happy to tell you more information about it. But for those of you who might be wondering, telehealth might be a great option for those of you that maybe don't feel comfortable coming into the clinic and or maybe have problems with access, from childcare or just being a high-risk individual. So hope everybody finds that helpful, and hope you guys have a great night.